I'm just jumping in to say 2-minute warning before we start.
So I'll be doing my speaking between 10 past 10 and 17 past. So I'm sure that's the case. So I'm just going to mute myself and I'll catch you guys in there.
Hello, Andrew Cookson. Can you hear me? It's Jim.
I can hear you loud and clear, Jim.
Good. Okay. How are you going? All prepared? All well? Looking fine?
Embarrassed me already. Yes, I am fine.
That's good. That's good. I didn't mean to embarrass you at all.
It happens though, right?
Well, it happens to me a lot.
I've been embarrassed my whole life.
Oh, hello, Greg. How are you?
Good. It's been just one continual embarrassment.
Look, I know exactly what you're saying. We must be related in some way, I think. So, looking forward to this. This is our...
Good morning, everyone. My name is Abby Srinivasan, and I am your MC for today's event. In the spirit of reconciliation, the Mental Health Foundation acknowledges the traditional custodians of the country throughout Australia and their connections to the land, sea, and community. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples here today. On behalf of the Mental Health Foundation Australia and the chairperson, Vasan Srinivasan, I would like to welcome and thank each and every one of you for attending the Day 31 of National Mental Health Month Awareness Campaign, Need for Integrated Mental Health Hubs, which is also the closing event for National Mental Health Month 2021. National Mental Health Month is an initiative of the MHFA to advocate for and raise awareness of Australian mental health as a community. The MHFA's National Mental Health Month is unlike any other mental health awareness campaign. It aims to bring together all Australians in a nationwide conversation about mental health, and we aim to maintain this conversation for an entire month and beyond. This is through a series of various mental health related events. National Mental Health Month is a program that the MHFA is extremely proud of, and we intend to reach out and educate as many Australians as possible to help reduce stigma and facilitate positive and non-judgmental discussion surrounding the important topic of mental health in Australia. With 1 in 5 Australians experiencing a mental health illness, it is time we give mental health its due attention, and that is exactly what the MHFA is wanting to achieve. Throughout this month, many events have been organised in each state and territory of Australia, aiming to attract and unite Australians of all ages and backgrounds to raise awareness of the need for better mental health for all. This year's theme of National Mental Health Month is post-pandemic recovery with challenges and resilience. And this year's theme will focus on raising awareness about mental health in various industries and communities. Each individual has faced, and many are still facing, unprecedented challenges due to the COVID-19 pandemic. With this theme in mind, we aim to extend our campaign even wider than previous years, with events planned to embrace many different community groups and people of all ages walking on the road to recovery and fostering resilience. Please join me in celebrating the work of the Mental Health Foundation Australia by viewing a short video.
Hi everyone, I'm Vasan Srinivasan, Chairperson of the Mental Health Foundation Australia. It's a privilege to lead this wonderful community-based mental health organisation in its 91st year of establishment. The MHFA has grown strength to strength over the past few years. With Victorian Mental Health Month in 2018, the National Mental Health Month occurring in 2019, 2020 and this year in 2021. Last year, COVID-19 did not stop us from achieving our National Mental Health Month campaign. I'm proud to say we successfully shifted many events to a virtual platform, very much being able to pursue our objectives of raising awareness and advocating for better Australian mental health. Our primary aim is to reach out to and educate as many Australians as possible, to help reduce stigma and to encourage constructive and non-judgmental dialogue on Australia's critical mental health issue. A highlight of last year's campaign was reaching out to 100,000 Australians all across the country for our national walks for mental health, both virtually through our MHFA app and physically in some states. What a grand success that was. In 2021, with pandemic still affecting many of us, we decided not to give up once again, curating a carefully chosen blend of virtual and physical events for Australians to participate in. This year, we have a new and improved MHFA app, giving people the opportunity to participate in National Mental Health Month from the palms of their hands. This year, theme is mental health and post-pandemic recovery challenges and resilience. Mental Health Foundation Australia is proud to partner with Australian technology business DB Results and take up the wellbeing app Am I OK? to support our members, enabling individuals to regularly check in on a private and secure platform and ask the question, Am I OK? Am I OK also alerts the user when it's time to seek outside help. We thank DB Results for this opportunity to promote well-being and early intervention. This year, we have launched a special initiative, the Mental Health Appeal on the 10th of October, our World Mental Health Day. Through this, we aim to raise funds for the development of a course promoting life and safety in young people. At the MHFA, we pride ourselves in making sure all our programs are for the community and powered by the community. We have a vast growing network of multicultural ambassadors, youth ambassadors, and future leaders who further the community voice in promoting mental health and well-being. Our multicultural network has inspired our educational and multicultural webinars as an initiative to assist individuals cope with success during the pandemic. I would like to take this moment to thank our board directors and patrons, scientific advisory committee members, our wonderful staff, multicultural and youth ambassadors, future leaders, MHFA members and major sponsors for their continuous support to our organisation as we continue to work to deepen understanding of the importance of mental well-being and educating the community. Let's work in solidarity for the benefit of our mental health. Thank you, Australia.
Before we begin today's event, we would like to thank all of our staff members of the Mental Health Foundation Australia: Adam Go, Aisha Usman, Akshay Subramanian, Anika Srinivasan, Felicity Mackin, JL Wong, Kelly Sims, Nithya Vishwanathan, Preeti Selvaraj, Priyanka Ananthakrishna, Ritika Purang, Susan Warby, and Vipul Verma. We thank you all for spending so much of your time and putting in all your effort into all of these events for this month. To welcome everyone on behalf of the Mental Health Foundation Australia and also to introduce today's topic, I'd like to call upon Professor Greg Murray. Professor Greg Murray is a clinical academic conducting mixed methods research into bipolar disorder, circadian rhythms, personality, and affect. He is ranked in the top 1% of researchers worldwide in each of these fields. After a career in music, he took out his PhD from the University of Melbourne in 2001 and has been a full professor at Swinburne since 2011. Professor Greg is also on the MHFA Scientific Advisory Committee. Welcome, Professor. Thank you for joining us today.
Thanks very much, Abby. It's a great pleasure to be working with MHFA again on this final day of Mental Health Month. What a great success that has been. Today's topic is really quite exciting. As someone said before, that it's a beautiful spring day in Melbourne at the moment. And in mental health worldwide, but in Australia in particular, there's a bit of a sense of the opportunity for refresh. In Victoria, we had the Royal Commission into Mental Health. And I suppose the main finding of that was not the fact that mental health is underfunded. Everyone knew that. The main finding of the Royal Commission was that mental health needs to be delivered smarter. And what did they mean by smarter? There's 3 or 4 things I want to pick up on which lead us to today's discussion. They emphasised that there is what's called a missing middle, a large group of Australians who are not acutely ill enough to get access to hospital treatments, but they have a moderate level of illness, which means that 10 or 12 sessions with a psychologist or a visit to the GP may not be sufficient. So they're having ongoing problems that aren't typically sufficiently severe for them to get into the hospital system. And they have waxing and waning problems. So that's point one, that there's a group who are being systematically missed. The other point that the Royal Commission made was that services are very poorly integrated and they really should be delivered in people's communities. One of the points in the Commission's summary document was we need to go from big medicine to big community. We need to ground the delivery of services in people's communities. And the other thing is that there needs to be an integration. So we're not just looking at mental health, but we're also looking at housing, education, physical health, legal issues. So people are being treated much more as a whole person rather than just focusing on what their diagnosis happens to be. So one of the ways of summarising the Royal Commission's findings was we need more holistic treatment for mental health. And some of the features that they're saying we need to, build into a new mental health system are, as I say, community-based services, integration of multiple services, not just health, but also social service, and preferably delivering those services in a place where the different professions and expertise can come together. The delivery of services should also be culturally sensitive to recognise that people from different cultures may engage, may prefer different types of engagement. And also recognising that some groups in the community have particular challenges. So, for example, the obvious one, which has become, very much front and centre in mental health over the last few years, is young people. And of course, the importance of young people is that's where mental health problems develop. And that's where we perhaps have the opportunity to shift people's trajectory from a not so good trajectory to a better one. And then finally, the other thing that the Royal Commission emphasised was that there has been too much focus on illness, too much focus on medication, and not enough focus, as Vasan said in that video, on resilience and well-being. And so one of the key aspects of that sort of emphasis in mental health, away from what's called the biomedical model and towards what's called the biopsychosocial model, is really involving end users in the development of any service you're going to offer, involving end users in the delivery of the services. So people who've had these sorts of problems can offer very powerful and effective support for other people who've had these sorts of problems. So that's the broad picture that came from the Royal Commission of what service delivery should be looking like in the future. And one example of what service delivery might look like in the future is the notion of a mental health hub. Remember, I said that there's a push for services to be delivered in a community in a way that integrates all the things that are going on in that community. So that's the notion of a hub. It's got a physical location and it creates a sort of ease of access. So it's not just access to multiple services. It's not just this more wellness and resilience focus. It's also easy to get in. And I was thinking about this, and this will be the last point I make before we start the broader discussion. I was thinking about the mental health service, which I've worked in for a long time and had personal contact with through my family and myself. When I think about the mental health services as it's traditionally delivered, I think of like a series of castles in medieval England. Great big things with high walls and complicated entry procedures, and you don't really understand who's in charge, but you do understand that if you don't do the right thing, you might be in trouble. complicated sort of secret passwords to get in. That's my association with mental health services. Now, of course, there are wonderful people working in mental health services trying to advance things. So this is sort of a cartoonish characterisation. But if we think of traditional mental health services as like being a series of castles that are very hard to get into and can feel quite cold, I think the theme that we're talking about with these mental health hubs is we're moving more towards not a series of castles, but a series of local pubs. Places that are warm, places that are engaging, places where it's easy to walk across the threshold, places where diversity is appreciated and in fact welcomed, and places which are rich in local contextualised knowledge. So from castles to pubs. That's just my take on the theme that we're looking at here. What we're going to achieve today by talking to the Youth Advisory Committee is some particular ideas about what a mental health hub might look like if it were operated by MHFA. And we're hopeful that that will be happening shortly. So welcome everyone. I hope you get a lot out of today's session.
Thank you, Professor Murray. I would now like to invite Mr. Andrew Cookson. Andrew is a mental health consumer with a varied background in mental health. This background includes work as a mental health worker, mental health first aid instructor, lived experience teacher, mental health certificate for teacher, and mental health peer work certificate for teacher. He also worked with the Mental Health Foundation Australia on our youth support groups. As a consumer, his experience spans over 19 years with many stories to share. Thank you for joining us today, Andrew. We are looking forward to hearing your powerful story.
Fantastic. Alrighty. So apologies for the photo. I had more of a beard in that case, not so much of a beard now. It's sort of there, but it's sort of not. So many apologies. I take it people can hear me. That's all good. That's all right. Excellent. So I'd like to tell a bit about my story and a bit about where I come from, and also make a comment about hubs in general and what I've learned about why they're needed. But to give you a bit of a brief background for me, what I wanted to talk about was where my story really started. And it started as a consumer when I was about 19 years old. And in that time, I basically was under a lot of stress from uni, traveling to a new place, getting used to a new environment, lost a few friends. And the intense pressure meant that I just woke up one day. Oh, I didn't actually wake up. I stayed awake the entire night, got up in the morning, started telling everyone that I loved them and that the world was a great place. And very out of character for me. And soon enough, I was treated for dealing with bipolar disorder and was hospitalized for a couple of weeks. And that was the very start of my journey. But thankfully, I responded very well to treatment as such, or treatment. I know that there's a bit of an issue sometimes with people saying that, you know, some will speak very strongly, as was said before, about the biomedical model and the biopsychosocial model, which I'll comment on soon. But I responded very well to medication and was out of there quite quickly. But the thing is that I don't see recovery as being purely about symptoms, as being purely about disease or illness. I see it as being about a recovery in a very broad, holistic sense. And that's what I've really come to learn, is that I was able to go back to university. I was able to have fulfilling relationships. I was able to be physically well. All of these things were really, really important to me. And I felt like I had a responsibility, because I recovered so well in the first place, to actually help other people recover in a similar way too. So I went on and I started studying psychology and became a mental health worker at another university, studied and learned to teach mental health first aid, became an expert by lived experience in an educational setting, as we said in a bit of my background as well. And I'm still teaching in the area as well, involved in lived experience and sharing that lived experience to help others. So I guess what I'm trying to say is that in spite of everything that I've done and every place that I've come from, I'm still just a person. I'm a person just like any other person, and irrespective of what label I might have or what diagnosis I might have, I have the needs of every other person. I have a need to have my physical needs met, my mental health needs met, my emotional needs met, my financial needs, my housing needs, all of those things that were mentioned previously by the professor, that are things that I still need myself. So I guess that's really what I wanted to say in that regard. The idea that we can treat somebody's illness and then have that as the final chapter really doesn't sit very well with me, because I believe that recovery is a lifelong story. It's a lifelong journey. And if I was giving you this story in maybe 10 or 20 years' time, it would be a lot longer. And I don't have more than half an hour to give you this story, unfortunately. So I'll just say this. I believe in a holistic approach. I believe that, and also the stories that I hear from the people in my course as well are stories of, I really wish that with my consent, of course, all of my people would just communicate with each other. I wish that I didn't have to tell my story to every single person I found. I wish that they would all be sort of a unified front for me. I wish that I could really express myself effectively to them and they would listen to what I was saying. I wish they looked at all of my needs rather than just a few of them. I wish that I wasn't someone that fell between the cracks or had a bad experience and didn't go back. So these are the stories I hear. These are the issues that I've heard people raise before when they've been faced with issues regarding the system, so to speak. And certainly they're ones that I can relate to, although I've had a very good run, mind you. I've had a very good run with medication. I've had a very good run with my therapy in general, with psychologists, with psychiatrists, with GPs. I have nothing but respect for all of them. All I'm saying is that it takes a multidisciplinary approach and it takes people to look at the holistic picture in order for people to find recovery. And essentially, I suppose that's exactly what I mean when I think of a hub. I think of a connected group of people. I think of a place where you can facilitate rather than instruct. I think of a place where you can collaborate with people rather than being told what needs to happen. That's how I see this. That's how I view the situation. So I guess that's what I'm going to leave you guys with is that notion of what I see coming up as a way that we're going to move forward. Of course, we're going to have a discussion about this, and I welcome that. But I suppose you have a bit of an insight into my perspective, and I thank the Mental Health Foundation Australia for letting me speak. So I think that's all I've got for now, guys, but I'll leave you guys to it.
Thank you, Andrew, for sharing your journey, and you've surely had an impact among the audience today who have tuned in. We wish you the very best. Next, we have a presentation from our Policy and Communications Committee, a group of like-minded individuals who focus on broader community and social perspectives of mental health. MHFA's Policy and Communications team are here with us today, and they will be presenting on the idea of integrated mental health hubs. To present, I now invite the chair of the Policy and Communications team, Alexander Lissov, and his team.
Thanks, Abby. I'd also like to first acknowledge the traditional custodians of the respective lands on which we meet today and pay my respect to the elders, past, present and emerging. I'd also like to say thank you to Andrew for your speaking up about your story and your experience. The strength in you talking up is critical to inform and the broader sector and helping others in their path to recovery. To get started with the integrated mental health hubs, it did first start in 2018. It was a 2-year process from there. In late 2018, there was a youth mental health and wellbeing conference during the Victorian Mental Health Month, where there was a direct opportunity for over 300 young people from all walks of life to detail their experiences with mental illness, and more pertinently, their interactions and feedback from their interactions with the mental health system there. So in that, we had 9 separate workshops that focused on a different range of conditions, with people who had first-hand experiences who were able to speak up freely and detail their issues and concerns with the system with it. This then followed up in 2019, 2020, where the Youth Ambassadors for the Mental Health Foundation then was able to provide input into the policy paper, and feedback was sought from the wider Australian community. Now, Tom will speak into further detail with the policy paper, and then we'll pass it on to Emma and Tia, who've done a fantastic job in detailing some of the examples of integrated mental health hubs abroad, and then we'll wrap it up from there. So Tom, over to you.
Thank you, Alex, for that introduction there. And that's right, what you were saying about the 2018 Youth Mental Health and Wellbeing Conference. That's what really kicked us off with our policy paper. We had 9 separate workshops. We had a couple hundred participants, I think. Unfortunately, I wasn't in attendance that day, but we had a lot of great detail from those participants, which we then filtered into our policy paper. We fortified that with some contributions from our youth ambassadors. I think we had about 10 contributors who gave us some of their personal stories and perspectives, and some of the research that they'd found about those particular conditions such as depression, anxiety, substance addiction. Those 9 were basically separated into different mental health afflictions. And then once we compiled that, we developed with the foundation 4 recommendations for the broader public and for the government, for universities to take on board. And one of those was the mental health hubs. We called them capital city drop-in centres. They're also called one-stop shops, a million different names for them, but essentially a mental health hub where there's a lot of services combined that can all feed off each other and make sure that the patient in a client-centered capacity can be supported through different services. And we were greatly supported in that by the Royal Commission. One of the recommendations of the Royal Commission, the Victorian Royal Commission into mental health, did also propose setting up some mental health hubs, which the government is doing on their own initiative as well. And there's been a lot of great international examples and some research done internationally that really strengthens our perspective on that. And with saying that, I'll hand it over to Emily Wong and Tia Van Herk, who can talk more about the research that's been done internationally about our mental health hubs. Over to you guys.
Yeah, so there have been multiple case studies of integrated mental health care hubs on an international scale, but there are 3 really notable examples. So firstly, that is the Youth One-Stop Shop in New Zealand, which services 12 to 24-year-olds. It's also Youth Space in England, which is works with a slightly older age range of 16 to 25-year-olds. And then there's Jigsaw in Ireland, where again, it's 12 to 25-year-olds that are targeted. They obviously focus on mental health and therefore provide a range of counselling, clinical psychologists and primary care, but they've also integrated, drug and alcohol education and support, youth workers to help with accommodation, job and career advice and support, even assistance in banking and law problems. So you're really sort of seeing that holistic approach there. All 3 of these services have had incredible success and popped up in multiple locations, but they've also reported a great majority of their users feeling a significant improvement in their overall mental health and wellbeing. But they've also reported greater levels of daily functioning. Anyone can access the services, but individuals that had difficult personal circumstances, so like unemployment, for example, found the greatest benefit because, again, that holistic approach. Collectively, their success has come down to 3 really highly emphasised factors. The first being accessibility, so rapid access to mental health care and intervention. 2, they are youth-friendly, which encourages engagement with the service and reduces that stigma surrounding access. And lastly, they have strong community-based partnerships and collaborations. So I'll let Em expand on that.
Thanks, Tia. So the success of these overseas models has in part lied in really strong community partnerships, and it's well documented, okay, across the board in our own setting and overseas, that linguistic and cultural minorities will experience greater barriers to accessing quality healthcare. Okay, so that's not just mental health, but across the board. If you front up to ED, if you are part of a minority group, unfortunately, you will face greater barriers to getting the care that you need. Compounding these effects, healthcare does tend to have a really Anglo-centric focus and method, which can further isolate these populations, regardless of the severity of illness or distress. Equally, then, neurodiverse and people with physical disabilities face structural obstacles to accessing mental health care. And this is where hubs can be a really key part of the solution. So mental health care is nothing without equity and nothing without accessibility. So through appointing familiar community leaders within the hubs and making the environment accessible, we can work to make mental health hubs a reliable and really user-friendly fixture in the area. And this looks like, okay, local dialects being spoken at reception, having information that is in your language in really simple language, bright and inviting spaces that don't resemble an intimidating hospital setting, okay? We don't want it to be a punishment for asking for help. So these are just some of the successes of One Stop Shop, Youth Space and Jigsaw, and unfortunately areas that are sometimes lacking in the Australian context. So hubs are not a silver bullet, but they will have a really significant impact for those needing our services the most, and they'll clear away some of that overgrowth of complications and revealing that path to help.
Fantastic. Thanks, Em and Tia, for all the research with that. We'll just go on to the final slide. And with that, this is all really informed the foundation and through the research of the conference, the policy paper and all that, experiences abroad into the Mental Health Foundation, that there's a roadmap for a integrated mental health hub to be launched in early 2022. And obviously special thanks and mention to Vasan, the chairperson, and Jim Gooding of the foundation, who's really brought this to light, as long as the scientific committee and the board. And this is going to be really a key thing to really address the issues that we've discussed today, providing that holistic approach so people can be able to navigate the mental health system and not fall through the cracks. It can be a really one-stop shop where they can turn up and able to get adequately referred to the necessary services there. I think this is really abundantly important, even in this COVID-19 times where mental health is really being prevalent in the national discussion. And this is going to really be important in helping address this issue going forward for young Australians when they transition to different parts of their life there. So I'll wrap it up now and thank the whole committee for their input today.
Thank you again to Alexander, Tom, Emily, and Tia. I now invite Professor Greg Murray to moderate the panel discussion for today.
Yeah, look, thank you very much, guys, for that really concise and informative overview of the notion of mental health hubs. That was really very, very impressive. And it's so exciting that MHFA is looking like they may well be developing something like this. I've got a couple of sort of starting questions just to get us going, and I'm interested in your views on these things. Firstly, we've been talking a lot about the culture of a mental health hub, you know, holistic, easy to access, culturally sensitive, etc., grounded in its local community. What do you think the actual services provided by a hub would look like? Well, yeah, let's start with that.
I'll have a go if no one else wants to start us off. Look, it's really going to depend a lot on the service providers and the stakeholders that the foundation engages, and there's a lot that's yet to be finalised. So I wouldn't be able to preempt any sort of announcements as to what will be part of it. But the key structure is, and we had a pretty good diagram on a couple of the slides there. would be that the person would just first of all be greeted by someone who has knowledge, some kind of social worker who has knowledge over what a person who presents to the hub might need. That they don't necessarily need to be a clinical psychologist, but just someone who can identify the needs, and then that would be someone who could refer. I think you could organise into three main pillars. There's probably most importantly, the clinical services that a clinical psychologist could provide, and that would be funded in large part by Medicare, as people are, if they need it, are entitled to Medicare subsidies for that. The second column or support, I'm not that good as metaphors as Greg and Andrew, unfortunately, so I'll have to ask you for tips later. But the other services like employment services, legal services, migration services, that would form another strong part based on the person's needs. And then I think the third part would be the range of support groups that the foundation has. That's already a service that the foundation provides, and it'd be fairly easy to integrate that into the mental health hub.
Just following up from Tom's point quickly, I think a really key thing is also addressing the catalyst, which Tom did say about migration services, financial, understanding literacy there, and a lot of the key catalysts that can cause or onset of mental health. Social housing is obviously so critical in that, and helping the integrated help to help the public in addressing those needs as well.
Yeah, great, fascinating. Someone. Pravati, I think, had a question. And so, Pravati, do you want to drop your question into the chat or the Q&A? While Pravati's typing that in, one of the things that I've been thinking about with the hubs is, the notion of hubs generally, is that any individual hub, like the one we're talking about now being developed by the MHFA, needs to be sort of contextually sensitive. It needs to be designed so it's doing something for the particular community where it is based. And so I was wondering what you think, guys, about if it did happen to be based in South Yarra, which is the address that we've been talking about, what are the characteristics of that community that might help MHFA decide what sort of services are important there? Does anyone have any sense of, how does the South Yarra geographical location compare to Brunswick or Brighton or Shepparton?
I'd just like to make comment on that, Greg, if I may. Traditionally, South Yarra has been a fairly affluent area. We're moving perhaps 2 kilometres from where we currently are at 450 Chapel Street, which is more in the Paran area, and there's a distinct difference in the population, should I say the wealth, if you want to put it that way, of the area. I think what is unique about South Yarra is that I don't think there's a particular demographic feature that makes it remarkable, other than its accessibility. 10 Yarra Street, where we will be locating with our new hub, is extremely accessible by public transport, by tram, by train, by bus. And I think that was very much in the thinking of the board of the Mental Health Foundation when they decided upon that location and approved of it. So it wasn't a particular characteristic demographically or financially or wealth-wise, just happens to be quite an upmarket area, but it certainly enables, it's easily accessed from virtually all points around Melbourne. It is quite a remarkably accessible site. And we want it to be that way. We don't perhaps want it just to be restricted to a particular neighbourhood, although I do understand that is a necessity for a community hub to be connected to that community. But we are hopeful that this is the first of many. We're hopeful that we'll be able to spread out from here. This is really a prototype model for the Mental Health Foundation, and we're hoping that we might be able to establish these sorts of hubs around Melbourne, around Victoria, and in fact interstate. So let's hope that the experiment works and is successful.
Yeah, that's great, Jim. Thank you. And so we've answered Pravati's question, which was, is it starting in Melbourne or in another city? It is starting in Melbourne. And that's very interesting, Jim, that you've chosen, that MHFA has chosen a location near a train station and other transport points. So the notion of community is complicated by the fact that people will hopefully be arriving from all over the place. But it's still, I think, that spirit of a hub where it should have expertise on its local community, you know, what other resources are around there. That still applies, doesn't it? That I think one of the main problems that we're trying to address with a hub is just the problem of the complexity of the health system. Emily had a lovely metaphor for that before, which I won't try and replicate, but clearing away the confusion of the system. I think that's something that the hub has to sort of take responsibility for, doesn't it? There has to be a lot of local expertise contained in the hub.
Well, I'll just make one more addition here, and then I'll turn over to the likes of our chairperson Vasan and Bruce Tong, etc. But at the moment, we're making many memoranda of understanding with different organisations, and the hub is very central in terms of those organisations that we're seeking to work with. For example, Victorian Multicultural Commission, Victoria Police, Salvation Army, Morris Blackburn, etc., Jobco, Launch Housing. All these different organisations are very accessible from where we are. So we're looking at those organisations as being our partners, and they're going to be part of our community network and web as we reach out. But I know Vasan is very active in that regard, in forming those links and liaisons.
Just to add on to that from there, Professor, we just went through the slides with our young team, the Youth One-Stop Shop, Youth Space in UK and Jigsaw, and also there's another one in Canada. I had a privilege to speak to one or two from each organization before we put these things together. What I understood from, especially from UK model, they brought it as a wellness wheel. So they've connected legal services, financial support, job placement agencies, and also refugee and multicultural engagement area. We also bring, as Jim said, Victorian Multicultural Commission, FECA, which is Federation of Ethnic Community Council, Australia, and ECCV in Victoria, and other community peak bodies like Indian community peak body, Chinese and Africans, sports-related advices, and also music therapists, culturally connected areas. So what we are trying to bring, the 24 wheels, 24 arms of the wheel, to make it as one-stop shop, like Tia said, one-stop shop. So anything and everything, the clients coming through the clinical side of it. So at the end, this wellness team will pick up and support to make sure it's outcome-related services.
Could I just make another point anyway, that it's come out of the Royal Commission, and the Victorian government is attempting to establish 6 primary healthcare networks, or rather they're scaling up these networks around Victoria. So we're completely in sync with the Royal Commission and what the Victorian government is attempting to do, without wanting to be expressed too much bravado, I'd say, however, that we're doing it on a much more achievable financial scale, and I would suggest much more efficiently. I'm finding it very difficult to find information. You're talking about the castle and the pub. Well, we're definitely trying to be the pub, to be accessible. I'm finding it very difficult to find information about those 6 primary healthcare castles that are being developed by the Victorian government at present. They are scaling up, but if you try to find out any information about them on the media, it's extremely difficult, extremely difficult. Whereas I think we're doing our best with our fairly limited resources to promote our hub within the community and certainly within the South Yarra area as best we can. And certainly, as Vasan said, that the 24 arms of the wheel that are spreading out, we're certainly linking in with those 24 organisations very strongly.
I would just like to say to that, because we certainly are in sync with the state government on their recommendations there, and a lot of their those 6 hubs aren't finalised on their end, but we do know that 3 of them will be in regional Victoria. I think one of them in Shepparton. I'm not sure about the other 2, and the other 3 will be in outer suburban areas of Melbourne, metropolitan Melbourne. I think one in Craigieburn, one in Frankston. I could be wrong about those exact locations, but it's 3 in the outer metropolitan area and 3 in regional centres. And that's completely inverse to what we're doing, where we're doing it right in the middle of the city. And we sort of have to do that because of the resourcing. It's much, for a small organisation like us, much easier, much better to get those resources centralised. For the state government, they have more latitude to put things where they're needed especially, and it's been seen that outer metropolitan Melbourne and regional Victoria is where some of those particular mental health issues are, so that's why they're prioritising them. But yeah, I just wanted to make the point that while they're doing their best in those areas, the Mental Health Foundation of Australia is looking to centralise it in South Yarra, very close to the city, linked to public transport and the rest of it. So it's really all areas, in a sense, are being covered by multiple organisations there.
Thanks, Tom. And you're also highlighting something that I think is probably important about this whole discussion, that these hubs aren't all going to be the same. They're going to have different emphases. Mental Health Foundation of Australia obviously has a very strong culturally and linguistically diverse focus. And so that may be a relatively strong focus of this hub compared to perhaps, I don't know, the Craigieburn hub or the Shepparton hub. Some, depending on who the partners are who come together to support the activity, and I know MHFA is interested in universities coming on board. So some universities will bring particular expertise in particular areas. I know Pravati actually just put another question there about virtual media or digital delivery. That's something that my university, Swinburne University, is very big on, and we would love to have this hub have a strong digital component. One of the things that I was thinking, we've been emphasising this community grounding of the hub, but the other thing that's really important for people, I was thinking about this the other day, is not just those local ties, but what they call in social network theory, the long ties that get you out of your community and into other places. And of course, that's what digital gives you. Digital gives you access to people in Scotland, people in Ireland, people who are doing similar things in other places in Australia. So we don't need to have everything local. We want the local knowledge, but that doesn't mean we turn our back on other knowledge that exists in greater depth or experience or know-how or support that exists in greater depth elsewhere. And once you get digital happening, and as Pravati said, young people in particular have grown up in a digital world, I think that's a great opportunity for this particular hub to be both real and virtual.
And if I may say, will really be a hub in that sense. I'm particularly thinking about our support groups, We have over 20 support groups at the moment. Unfortunately, due to the COVID situation, they haven't been able to run face-to-face, but they have been enormously successful running virtually.
Yeah.
And we have had, in fact, an international audience. We've had people from the UK, people from Europe, people from Canada tuning into our support group. So I can see, there are lots of opportunities here for it to be not only that local group, but also, what would you say, a virtual centre for a lot of people in their recovery journey, as Andrew puts it.
Just to add on,
that,
Professor,
sorry, Vasant.
just to add on, Professor, my understanding, the Victorian government has written to 12 local government councils in relation to establishing hubs. So that's when just the process began, just a month or two ago after the Royal Commission's final report. When government get involved, it'll cost you millions and millions to establish what we are establishing in South Yarra. Not only that, the time and the red tape through the council engagement, it may take just a day before the election next year. So by the time we are ready to run.
Yeah, I think that's a really good point, Vasan, that by sort of acting quickly and in a kind of focused, decisive way, the foundation is doing great work, not just for the community, but for the government, because as Jim was saying, the notion of a sort of test case, how does this actually work? Let's get this up and running. Let's, nut out the problems, get it working. Clearly, that's what the Victorian government needs, is how do you get this to work, rather than the sort of top-down idea that comes from the Royal Commission, the theory. I think that's one thing that I'm very excited about with this hub, is we're going to give it a go and work it out as we go. Paying close attention to, obviously, evaluation to make sure it's working, and research opportunities as well. But yeah, we won't be cowboys, but we will be taking action rather than sitting around and talking. So I think that's very exciting.
I think as well, it's necessary now, especially after COVID. You've had levels of extreme social isolation. You've had job unemployment. They need these services, now. We need to start acting now.
Yeah.
And yeah, as Vasan said, with government, it could take years,
Yeah, thank you, Tia. Andrew.
Yeah, I had a question for everyone. I've got my own opinion on this, but I'm just responding to what Jim said before. I'd like to know what all of your opinions are on this one, because I can think of a number of reasons why having a hub which is sort of central and easily accessible would be an advantage, but I can also think of ways which it would potentially be a disadvantage. And I'd like people to comment on either of those two ideas. I'll come in with my own comment afterwards, don't worry, I'll say it, but I just want to know what everyone thinks.
I know what I think, but I'll let someone else answer.
The advantage.
Sorry, no, Vasan, you go.
Sorry, the advantage is, Andrew, if you look at South Yarra, the reason we thought it may work for our mental health foundation's benefit, we got 17 universities within 10 kilometer circle.
Yep.
All are absolutely connected with public transport. Whether it's a Victoria University or RMIT, Melbourne, Monash in the city, and Central Queensland University, Catholic University, Swinburne, all of them just within the 10 kilometers range. So to me, that's the best connection for the youths to come on board.
Can I just make the point too? And I think Andrew really made the most salient points when he spoke about the different models. And our scientific advisory panel has warned us about this, or alerted us to this, that we don't want a clinic as such. We want something that is, as you said, a collaborative, interpersonal, social experiential place. We don't want to just be another clinic where people, go and get their tablets, their injection, their bit of counselling, and off they go. But that's a challenge for us. That's the balancing act that we've got to get right. It's not going to be an easy process, and we don't think it will be. But this is a process of development, invention, collaboration, as we're doing now. We've got two wonderfully knowledgeable professors. We've got the lived experience. We've got young people here. We've got our social connector, Vasan. We're inventing as we go. We don't have the money to run this facility for 3 years, unlike government can do, allocate money for a 3 or 5 year project to a particular facility. We're taking a leap of faith. We're believing that we can raise this money and keep this going and sustain it. And all indications are that we can in fact do that. But it's going to be a balance to get those levels right. The clinical, if you like, and the experiential, and it always will be.
Emily, I think, had something to say.
Yeah, sure. I think part of what is at the core of this model is that we're going for sort of buckets of care. Okay, so it'll be a little bit clinical, a bit social, and then other interventions. So things like housing, alcohol and drug counselling, support groups, things like that. And COVID has presented a number of challenges, no doubt. But what we have learned is how to sidestep some of those and to connect virtually in forums such as this. So a whole lot of that care that we are trying to deliver, we understand we're not going to reach every single person by having a hub in South Yarra. It will be inaccessible. There'll be barriers and challenges there. It's not like we can't help everybody, but we do know that virtually. So if we're running support groups virtually, things like telehealth as well. I mean, that's really taken off this year, and we were skeptical about that, and it's worked out really well. People are doing consults from a home environment, from a place where they feel safe to be vulnerable, and so we're delivering still really accessible, really quality care, and it's a way for us to reach people that otherwise geographically might not be coming to the hub, or financially, whatever it is, and making sure that that's an equitable service for them.
Great, thank you. Look, I'm conscious of the fact that Andrew set up this question and he tempted us by saying he was going to give us his answer at the end, and I can't wait any longer, Andrew.
Well, I'm in thunderous agreement with all of you about the positives. Obviously, having a central area where people can easily access means that you get a fantastic number of different backgrounds, different issues related, different people, and all of those things mean that you get a broader range of the community and so forth. And that to me seems like the ideal thing to have. It would be great if we could cater to more people, and rather than fewer. That seems to make perfect sense. But I think Samantha has just stolen my thunder. But anyway, what I was going to say was, Jim, in talking about the demographic groups that are associated with South Yarra, you sort of said that there's no real single group that's there, and because it's so accessible, we were talking about having to make all of the different services available in the language of the people who we're dealing with. So as such, if it's accessible to everybody, you need to talk about being able to cater for a wider range of different backgrounds in different people. So I think that would probably be quite a challenge to have for a group, is to be able to cater for a wider range of people when you have a wider range coming in. That's my thought. Certainly coming from and there's no doubt that culturally and linguistically diverse speaking, Melbourne is very much diverse when it comes to that. So that's one thought that I have, and I'll leave you with that.
Can I just make a comment that we did have a slight problem in that we've got very strong connections as far out as Casey in one direction, and Wyndham in the other direction. So, you know, in a sense, we didn't want to lose our service into those communities. Centrality and transport were very important. But look, I take your point, and these are all very complex issues. But I trust we will work through them. We always have, and you know, with the goodwill and guidance of all the people on this panel and elsewhere, we'll work it through, I'm sure.
We haven't heard from Professor Bruce Tong. Bruce, what are you making of these discussions?
Well, I'm making an enormous amount, and in fact, I'm very pleased just to be listening because that's how we're going to design this. This has to be done by what we call co-design, and we have to listen and respond appropriately. I'm actually speaking to you from the land of the Jiru people in North Queensland at the moment, and I acknowledge their elders past, present and emerging, and acknowledge also that our First Nations people have experienced enormous stress over many generations and live in a land that was never ceded and was stolen from them. So with that as a group, we can't tell them what sort of hub they need. But I hope that one of the spokes that our hub will have in it is connection to our Indigenous communities, wherever they might be, so that we can work together with them. Now, it's interesting, I've had quite a lot of reflections. One of them is that, of course, a national crisis, we've known from long history, can often lead to what we call second order change. That is, new doors opening, new ways of doing things. And the Foundation has learnt that. We've gone from a situation of a total lockdown where we were despairing about what on earth would happen in Mental Health Month to a new dawning. I don't know whether people would know this, but, and the numbers are still coming in, but we've had communications with, we've attached to over 900,000 people who've connected to our 40 events. So there's something about virtual communication. Our hub must have a virtual element to it. We know it works. We've had, how many do you imagine went walking with us for Mental Health Walk? Over 500,000. That's unbelievable. We even had more than 3,000 people join us for the nationwide launches from the various states. So that's quite extraordinary. So it's really actually very exciting for me. And there we're joined by our animals too, fabulous. And that they walked with me, I must say, on the day. One of the opportunities that's flowing from this is this new energy, which was generated from over Mental Health Week and then month over 3 years, particularly by, again, the lived experience and by young people themselves in coming up with this notion of a hub. Now, I like that metaphor, that analogy, because if you look at a hub, it's connected to an axle where the power comes from. It distributes that power through spokes to the wheel so that we can go forward and we can travel. And I think we'll be travelling on a road towards greater social capital for our communities. And part of COVID has also been the Royal Commission in Victoria into mental health, which was hugely informative. And I think they've provided us with an axle because their aspiration, and I think it is ours too, is, and I'm quoting here, a complete transformation of mental health wellbeing and treatment, care and support that will be provided in community-based services. So that's our axle. We've been given the tick, the go ahead. And what's our hub got to be responsible to? Well, it's got to be responsible, again, the Royal Commission identified a number of things. that services are undersupplied, poorly integrated, inequitable, and they're not focused on mental health prevention and well-being. So that's our challenge, and our hub has got to address those inequalities. Now, the other thing the Royal Commission pointed out is that ideally, the community services should cover a few areas. There's early in life, and there's adulthood, and there's later in life. But we've been guided by our Youth Advisory Committee and by a number of our summits to focus on one of the foci of the Royal Commission, which is youth mental health, 12 to 25. So we've got the axle, and we're now looking at what the hub is. And it's obviously a community mental health and wellbeing system, not a clinic, a system. And it'll focus on the age band of youth mental health, which is recommendation number 20 in their report. And again, their words in the Commission report are very prescient, aren't they? It will provide a support community of place. Now, clearly it's a geographical place, but for us now, we've learnt that it can be a virtual place as well for young people. It will be inclusive of identity. Now, that just doesn't only mean cultural identity, but gender identity, for example. And it will be a safe place. Because particularly our cultural communities, such as our Indigenous communities, need to feel culturally safe. And it'll have a number of core functions. And again, this is resonating with the Royal Commission. It'll provide treatment, therapy and recovery services. So that's one element. And we've heard about that particularly from Tia and Alexander and Tom and Andrew and Emily. But it'll also provide wellbeing support. And we heard, didn't we, from Andrew about how important not just the treatment was, and he acknowledged how effective that was for him, but he needed support with his well-being. And thank you for that, Andrew, for highlighting that element. It's got an educational focus too, and of course our universities and others will come in there, but it's a peer support one. In other words, this is co-design. You know, an oldie like me is not telling young people how they've got to run their lives. We need Alexander and Thea and Emily and Andrew and Tom and a whole lot of younger people, either than you guys, to tell us what we need to be doing. And it'll be one of self-help. And of course, the Foundation's expert in that area. We've been running self-help groups for many, many, many years. We know they work. We know how important they are. And finally, it'll provide case planning and coordination. And that then gets out of the hub into the spokes to get us to the wheels, because already, as Vasan and Jim have pointed out, we're establishing memorandum of understanding and linkages with a whole range of people, particularly to link in with housing or legal advice or issues around juvenile justice and so forth. So it's very exciting. And each of those points I've mentioned actually links in to a recommendation in the Royal Commission report. What I'm encouraged by too, and this is where I think we've got to hold the government to their promises. There are two things in the Royal Commission report which give us hope. One is it does mention there'll be funding for non-government organisations, and that means us, to provide wellbeing support. So I will have no shame in going up to Spring Street and saying, show us the colour of your money. And secondly, it will provide funding for what they call community collectives. And isn't that what we're talking about? So, you know, we're going to take off, not like an Elon Musk rocket, but something like that. The only slight problem I have with one of the analogies today, and I just raised this with you, Greg, is the notion of the pub as similar. Now, of course, I did my training in Great Britain, and I know about how important the local pub is, because it's really your lounge room, because people live in small houses that are cold and they go out to the pub to socialise and all the rest. The only problem I have with the pub is alcohol. And I'm not a wowser at all, but I think we've got to come up with an image of where we all gather is also a safe place in all sorts of ways for us. Because one of the problems with COVID is that I think alcohol has been enormously socialised and put out there as the solution to our difficulties. In other words, we have to provide as a hub mental health education about healthy living, simple living, about looking after the environment, and all of those things that matter really to the young people, because they're tomorrow's generation. I've spoken enough.
Thanks for that, Bruce. Yeah, I was conscious of the alcohol limitation of my metaphor. I knew it wasn't, you know, I thought it had so many qualities, but damn it.
A pub with no beer, Greg, I think is the appropriate phrase.
One of the things we're talking about, and one of the things that I think for me is emerging from this discussion is we're kind of in ferocious agreement about many principles, but we've also started to grapple with some of the details and tensions in the plan. And Jim, you summarised those nicely. There is a fundamental tension between someone who is currently psychotic and someone who is coming because they're 17 and their mum and dad are splitting up and their well-being is suffering, but they have a family history of mental disorder and they're worried that they may be getting an anxiety disorder like their auntie. Those two people probably need quite different spaces to feel welcome and safe. If we're thinking a broader definition of well-being and flourishing and recovery, then we may, as the bipolar life people were talking about the other day, want to involve artistic activities. We may want to run painting workshops or drumming workshops, which I'd be very happy to lead. But that may not be appropriate for people who have chronic anxiety disorders, and the intensity of the stimulation that other people find very refreshing and engaging might be experienced by them as threatening. So I do think that I'm really glad that we are starting to get into the weeds of this. It's not immediately obvious how we get all these different features to come together for the very different types of people we want to engage with. And I think, that, again, I agree with Bruce. I think this is very exciting to have such a great group of experts with different types of expertise to try and nut this out, to kind of get it right, because I think the Royal Commission has got all the values right, in my opinion. They've got all those top level ideas right, but how that translates into practice, how, you know, for example, we train clinical psychologists in a very clinical model of mental health currently. We would like to train them in a more humanistic model of mental health, but that's not currently what the accreditation guidelines require of them. So there are really interesting challenges and opportunities, I think, in this hub about trying to do things better, and not just theoretically better, but actually in the lived experience better. Any final comments before we wind up and go for a walk in the sunshine like we all should be doing?
I've just had a little squiz in the chat, and Pravati has raised sort of an anecdotal example, but in her previous question has also spoken about the importance of virtual media. So I just wanted to link those two ideas briefly. And I'm really sorry that this happened, and I know that this will not be the only example of its kind, okay, where that experience of extreme isolation meant that help wasn't sought, okay. I think a big part of our messaging and a big part of certainly our virtual engagement has to centre on you cannot scare us. We are on your side. And that help is available, and help is available to you, and that it will not be a judgment. It is not a stain on your character to ask for help. It is the bravest thing that you can do, is to ask for help, or to ask for help for a friend, because that ripple effect is substantial. And I think that we are all living in other people's ripples a little bit at the moment as we're navigating whether it was COVID-related anxiety or now re-entry anxiety. There is a heap of that around, and we are all we are all part of people's sort of communities of care, and making sure, again, that our messaging is reaching the people that it needs to. So as Pravati said, young people are much more inclined to seek virtual help or to do sort of online chats and things like that, making sure that our messaging is really consistent, that, there is this help available, and that it'll be delivered to you in a way that you are I can't always guarantee that you will be comfortable or that you will feel good about it, but that in a way that will help you, and in a way that you will be listened to, and that your needs will be met as best that we can.
Well said, Emily.
I'll just say a few things as well, Professor Greg. I think it's very exciting, this thing from the foundation, and the integration of a lot more services than generically would be done with a lot of with a lot of these hubs previously, with social housing, migrant services, financial help, whether it's legal help, and really the wind is in the sail for this to be the next real key thing to be instituted around Australia. And obviously it's had a lot of great success abroad, and it's really good that the San's really touched in with these services abroad and really got their feedback there to help inform the foundation best as possible going forward.
Great, thank you. Any other final comments before we wrap up?
Oh, look, I just, this might be anecdotal, but I was speaking with the mental health professional that I see regularly, and I mentioned that I was doing this panel today, and I mentioned that Bruce Tong was going to be involved, and this professional, he started saying a lot of very good things about Bruce, and I don't know if you know Richard Young, Bruce, but yeah, he was saying that you had helped him out a lot. So I just wanted to give you a shout out there, and I just wanted to say to everyone that that we're very grateful, and we are getting a lot out of having Bruce's involvement when it comes to this mental health in particular, and just all the initiatives that the MHFA is involved with. And I think he definitely deserves to be in North Queensland, I think he said. That's the perfect place, I think, for Bruce to yeah. I mean, if we can send him up to Queensland more often, that should be his reward, I think. And I also just wanted to shout out the staff that have been, this is the last day of the mental health month, and I know from previous mental health months that I've been involved in that having events almost every day it can be quite challenging for our office staff. So I just wanted to shout out that it's been obviously a very busy month for them organising these events, and yeah, I just wanted to say well done, and that they deserve some rest, I think, tomorrow for all the good work they've done so far.
Thanks, Tom. All right, so I think we might call it to a close there if there's no more comments. This has been an incredibly stimulating discussion with, as I say, with all different types of expertise being brought to the question. It's great to be spending my Sunday morning with like-minded people who are excited about nutting out this wonderful opportunity that's been set up by the MHFA. And I've just had a toasted sandwich arrive, so my day is really seriously looking up. So thank you very much, everyone. And I personally am really looking forward to continuing to participate in these discussions. So thanks, Vasan, thanks, Jim, thanks, Bruce, thanks to the Youth Advisory Committee and all the staff at MHFA and the people who've participated in today's discussion. It's going to be exciting times ahead.
Thank you so much to Professor Greg and all our panel members. We all have great takeaways for today, I think. I'd now like to invite Professor Bruce Tong to officially close a very successful National Mental Health Month for 2021.
Well, indeed. And thank you, Greg, for already starting this process. And I could imagine you actually in the background giving a drum roll, perhaps as a great introduction to a mental health celebration riff. Well, what can I say? This has been an extraordinary effort. If you can imagine a whole month of activities every day, 900,000 people at least reaching into these activities across 40 events. 500,000 people joining us on the National Walk for Mental Health. And it's been run on a shoestring. The Mental Health Foundation Australia has no great resources other than people. It's mainly operated on volunteers' time. And so I firstly thank sincerely all of the volunteers that have been involved behind the scenes, getting information ready for advertising, preparing PowerPoint slides like the one on which my image is appearing in front of you at the moment, helping with the incredible complexity of online presentations using PowerPoint and so forth. We haven't got a television studio running behind us with millions of dollars of equipment. We have a modest studio is using donated materials. So it's been the volunteers that have driven this, and I thank each one of you. There's also been a small number of dedicated staff of the foundation, and again, they've been working 24/7 beyond the call of duty. Most of them with other things and other responsibilities in their lives towards family and children and study, and they've been pitching in. So thank you all, particularly so ably led by Aisha, our manager. We've also got a very energetic and nationally representative board. We have our board members from all states in Australia, and they again are providing of their time freely, pro bono, to make our foundation flourish. Thank you all board members. We also have at the moment a wonderful chair of the board, Vasan Srinivasan, who again, he's got a life, he's got a business to run, and yet has been working tirelessly, not just to see that this month operates well, but incredibly in many ways to inform politicians and policymakers about what the foundation is doing. The Mental Health Foundation Australia is now well known to both state and federal governments because of Vasan's hard work. And that has to happen because we can't run without government support. But beyond that, also reaching out into the community for support from our range of key supporters such as Australian Unity and Chemist's Own. And without their support, we couldn't have run this month. Of course, we do need much more in terms of funding, particularly to get this hub running. So any of you who haven't yet donated to our Mental Health Month fund for getting this hub up and running, please think about it. As we say, even dollars count. We're not saying it should be a huge amount, but if you feel like supporting us financially, we'd be very grateful. And of course, all of your financial support is tax deductible. Also to our Deputy Chair, Jim Gooden, a good mate of mine. Thank you, Jim. You're an inspiration to us all. And Jim particularly encourages the support networks and support groups that we run. This is a great initiative of Jim's, and it's one of the centrepiece of the foundation. I'll finish there. It's been a great month. We've all enjoyed it. It's been hard work, but that's fun too. And we hope that this will open the door to a year in Australia, this great nation, of better mental health, where we can build our social capital and forge forward in times of great challenge, such as climate change, welcoming refugees, making this an inclusive society for all. Go well, stay safe, all of you, and above all, please at this time, make sure that you're double vaccinated. That's a very key way of caring for the community. Thank you, Abby, for your chairing of this meeting. Again, it's been lovely seeing your smiling face on a number of these sessions, and to all of the chairs of our sessions, I give thanks.
Thank you so much, Bruce. And I just want to take a moment to thank everyone who has joined us throughout all of our National Mental Health Month events. And in particular, to all our speakers, our Scientific Advisory Committee, our youth ambassadors, our multicultural ambassadors, our future leaders, our policy and communications team, the Mental Health Foundation board, and in particular, like I mentioned at the start, our staff members and volunteers who have been crucial in this event, and they've just done such a great job, especially with our online and physical blended. And after 2 years of Zoom, we cannot wait to be in person next year, and I think we're all just very eagerly waiting to see each other's smiling faces. There's so many more events coming up, especially in December, so don't forget to follow along Mental Health Foundation on our social media pages, so Twitter, Facebook, LinkedIn, and Instagram, or sign up for our newsletter at www.mhfa.org.au so you don't miss out on anything. Have a great day and please enjoy the sunshine.